Dr. Adil earlier had spoken about the hub and spoke model and asset-light approach. If you look at the CFO to EBITDA, I believe this is reflected in our approach. Over the last 3 years, we have averaged at close to 83%, and as of H1, it is close to about 88%. With higher focus on collections, the receivable days have also dropped down to close to about 22 days. The inventory days have hovered between 50 to 65 days. And again, as explained earlier, with the focus on managing key vendor payments, the payable days have also been steadily dropping. Here, after this, I would like to take a minute to actually summarize the opportunity. We operate in the fastest growing single specialty space and are India's largest eye care services provider, and we are 1.7x of our nearest competitor. In terms of market share, we hold close to 25% market share amongst eye care chains, and we have a proven operating and expansion model, and we are led by doctor promoters with a focus on clinical excellence. We believe all of this is reflected in our revenue growth, profitability, and capital efficiency. That's it from my side on the presentation.
We can open up to you.
So basically, ladies and gentlemen, what we wanted to show you here is in this about Agarwal Hospital being this, that you can see as in a nutshell, I'm just trying to summarize everything for you all, that you have about 209 hospitals in India and Africa. We are based in about 10 countries, and last year we did about 45 centers, and this year in the first 6 months we did about 30. That comes out approximately average. If you see, we've already done about 1 center opening per week. The idea here is this: to create high quality eye care at the doorstep of the patient. And you can understand from 1.5 billion population in India, 1.5 in Africa, 3 billion population, the amount of expansion which is possible in eye care segment.
Thank you, Doctor, for the synopsis. We can proceed with the Q&A. Request you to please raise your hand. We have someone with you on mic.
I would like to know, the IPO is planning to use some of the proceeds for repayment out of debt, right?
Yes.
So can you just elaborate on, the debt that was taken on the books? What was that for? And also there are future expansions in organic growth that is being planned. Given that you've already grown at such a rapid pace, how do you plan to balance out funding for those?
Sure. Thank you for the question. So we are looking at a primary offer of 300 crores, out of which 195 crores will be used to retire debt. Gross debt on our books as of 30th September 2024 is approximately 373 crores. So we are net debt positive because we have a certain amount of cash and cash equivalents and a certain amount of lying investments as well. We are looking at bringing down this debt quite significantly by more than 50%. Now, this debt is primarily used for expansion purposes, both greenfield and brownfield expansion. We've been doing that over a period of years, which is why it is out of 380 crores, and looking at reducing this debt quite significantly.
Okay, so as of today, after the proceeds that come in, you will probably net it off. Sorry, I didn't get that.
So 195 crores will be used to retire this gross debt, which is at 373 crores. So it will come down to about 175, 180 crores, the total cost.
Okay. So going ahead, future acquisitions, how do you plan to, will you be taking on?
So for future expansion, I think we have a fairly healthy balance sheet right now in terms of cash and cash equivalents, and also as our CFO had mentioned, if you look at our EBITDA to cash flow conversion also is pretty healthy. So I think based on internal accruals and whatever cash we have in balance, we should be very comfortable with this for the next 3 years.
Thank you. Thanks so much.
Firstly, a very impressive journey.
Nariman point nine. It takes 1 year, at least minimum 1 to 2 years. Now, if you are opening in Zambia, for example, license हर country का अलग होता है. Zambia is different, Mozambique is different. So it takes a lot of planning. And other will update on how we go about locating which is a good location, which is not a good location, etc.
Sure. So I think it's been an interesting journey over the last 3 years, and a significant amount of effort has gone in. So if we see our expansion strategy, we have focused predominantly on the southern markets, which we consider our core markets. These are the markets where the brand equity is pretty well known. In the last 6-7 years, we have explored newer regions such as Maharashtra, Gujarat, Punjab, and we've done a combination of acquisitions and greenfields to enter some of these markets. Our strategy, like I mentioned before, is a hub and spoke model. So we establish a large hospital in the center of the city, and then we set up these feeder centers in different suburbs of the city so that people have access. If you have anything a little bit more complicated, then you get from there referred to your central hub, which is your large tertiary center, and that's the expansion model we have used to kind of penetrate deep into markets where we are present.
Speaking about the hub and spoke model that you
Yeah.
very rightly mentioned, do you also have something like telemedicine or some facilities that are for a smaller hospital or a smaller center, the bigger center can take use using the equipment and then guide the doctors or bring the patient directly to the hospital depending on the condition. Anything?
So our smallest format is what we call as the eye clinics. These are average between 750 to 1000 square feet. Now, one of the reasons why we have these clinics is if you want to enter tier 3, tier 4 markets, certain villages where we are present in, certain micro markets, the biggest bottleneck in these places is having a doctor. So how do you solve for this problem? Many of these eye clinics now are equipped with teleconsultation services where they are linked to the base hospital, and then as and when the patient requires, you have video conferencing facilities where they can get consulted with these doctors sitting on these base hospitals. That's how you're actually able to expand the reach of your hospital network into far-reaching markets where it's difficult to set up large hospitals.
So could you tell something about your technical innovation that you are already having and what you plan to expand to and what new technology you are going to use for such?
So we have two forms of innovation which we'll talk about. One is like what Dr. Amar was mentioning, which is the surgical innovations, and I will request Dr. Amar to talk to you a little bit on surgical innovations. And the second aspect is we have ensured that all our hospitals have the best quality technology available for all kinds of services. So we work with the best equipment, with the best manufacturers, and we make sure we leave no stone unturned to provide the best equipment across our hospitals, both for investigations and for surgeries. But I think in terms of surgical innovations, I think it will be apt for Dr. Amar to talk us.
I give you a small example. मैंने आपको सबको समझाया ना for lens example. The lens is damaged, you replace it. Now, okay, you are sitting in Mumbai and you say, Amma, please come and operate so and so patient, I'll come and do it. But let's give an example. If you are in Mozambique, okay, what we are endeavoring is the same blue dial technology is happening in Mozambique also. The same thing is happening in Ghana also. It will happen in Telangana also. So basically, if you notice the system, whether I'm talking about a pinhole surgery, where we are avoiding an eye transplantation. So let's understand this. Imagine if I have to take somebody's eye and put it in the other person's eye. It's a fantastic surgery, but listen, it has its own problems. There will be rejection. By the pinhole surgery, we are avoiding it. So far, so good. But can I replicate this in other centers? The answer is yes. And is it being done? The answer is yes. Because now forget Agarwal Hospital. Since these are innovations, they are going around the world. So even if you take the latest Journal of Cataract and Refractive Surgery, there is a Russian doctor, there is a Vietnam doctor who are talking on pinhole surgery. So that is where innovation makes a difference. अगर मेरे को phone बनाना है, where did Steve Jobs make a success? He brought out the iPhone. He innovated something new. And I've always believed when you have the innovation and the business combination together, then you have a real complete picture.